Healthwatch Essex are a really important partner for how we work with people in communities across Suffolk and North East Essex. They provide that influence and guidance and support to help us not only reach and engage with our local communities around their experiences of health and care, but also the right way to listen and respond to that as well. They're really well respected amongst colleagues working across Suffolk and North East Essex, and therefore they're a really important and strategic partner to us. Over the past 18 months, we've been doing a lot of work to embed co-production within the Integrated Care Board, but also more broadly across the integrated care system. A key part of that has been about the training and sort of progressing the knowledge and understanding of co-production, and having them there to do that with all of the years of experience they have of doing co-production has been really, really important. So they've done quite a lot of delivery of workshops in North East Essex to not only colleagues working within the Integrated Care Board, but also other wider partners. So that's been a big help for us. Also, in the past year, they helped with the development of our future shift strategy, particularly with their ambassadors, enabling us to reach people with lived experience to ensure that their views and voices were heard and kind of reflected within the work that we did around future shift. And also they've helped us on our research engagement network. So previously they've done some evaluations for us, and more recently they've done some work to co-design some guidance which helps kind of demystify what research is. The Research Engagement Network is all about opening up research to communities and people who perhaps wouldn't normally take part in it. So that kind of co-design of really making it more accessible and understandable has been a really great piece of work for us. I guess when we think about Healthwatch, often what comes to mind is those phrases around being a critical friend, and also their independence as an organisation to reflect the views of local people. And those things are really, really important. It's important that we have that check and challenge in the way that we develop our services. But I think for me, within that phrase, critical friend, there's a bit about the friendship we have with them. And as we say, over the past 18 months, we've really been doing a lot of work to really kind of progress and develop the way we work with people and communities. And that can be really quite tricky at times. I work with a lot of colleagues who genuinely have such belief and want to work with patients or local populations to really hear their views and make sure that they're represented, but that's not easy and often is really complex, and often that feels like there's a lot of challenges and barriers to have to overcome. So being able to have someone like Healthwatch there where we can just ping them an email and say, look, this is what we want to do. These are some of the challenges, and just being able to have a chat about it and kind of work through the ideas, again, using their experiences, it's been so important, particularly for me in the role that I do.